Hello, my name's Simon Howard, and I'm a consultant in health protection with Public Health England in the North East. And hopefully, you've watched the video we did earlier in the week, in fact, last week, about North East schools and COVID-19. And as part of that video, part of that webinar, we asked if people had any questions that they'd like to submit, and now we're going to answer some of those. We've arranged them into 4 themes in 4 separate videos. The links to all of the others are in the description for this video, as is the link to the original webinar. But in this video, we're going to concentrate on questions we've had around sending pupils and colleagues home to isolate. And the first question is, do households have to socially isolate if a child in the household has been sent home? So the answer to this question is that only contacts of confirmed cases need to self-isolate. So if the child has been sent home because they themselves are a contact in the school environment of a confirmed case, so for example, if a bubble is sent home, then only that child needs to self-isolate, though if they're young, clearly someone will need to look after them. If the child themselves has symptoms or has had a positive test, then their whole household needs to self-isolate, because that's the rule for anybody, any member of the public. If you test positive or you have symptoms, your whole household has to self-isolate. The case themselves has to self-isolate for 10 days and the household for 14 days. So the answer to that question is, it depends why the child has been sent home from school. Next question. As we enter into cold season, how can we tell the difference between COVID-19 and a cold? The important thing here is those 3 key symptoms. So the high temperature, the new continuous cough, or a loss of or change of sense of taste or smell. If you have any of those 3, you need to self-isolate and get a test. And the rest of your household needs to self-isolate as well while you await that result. If you have more general symptoms, so if you only have a runny nose or you're sneezing or something like that, but none of those 3 symptoms, then that's fine. As long as you're well enough to be in school, that's absolutely fine and people can go to school as normal. But the moment they get a new continuous cough, a fever, or a loss of or change of sense of taste or smell, then they need to be self-isolating and get tested. What action should a school take regarding self-isolation or other advice if a child is absent with a cough, but NHS 111 or NHS 119 undertake an assessment and determine that the cough is not consistent with COVID-19? In these circumstances, 119 seem to decline to arrange testing. Too many ones in that question. The answer here is that we need to think about the clinical assessment that the child has had. So if the only symptom they have is a cough, and they've spoken to a clinician and been assessed by a clinician, either on 111 or 119 or via their GP or something like that, and they think that this cough doesn't represent the new continuous cough of COVID-19, then that's fine for them to come back to school. So they might be diagnosed with something like hay fever, although unusual at this time of year, or any other kind of allergy sort of cough. They may have assessed it and just decided this doesn't meet the definition of a new continuous cough. So like asthma, you can have coughs on and off. It's not a continuous cough. It wouldn't necessarily meet this definition. So if they've had a proper assessment and that's their only symptom and the clinician is happy that this doesn't represent COVID, then that's fine. They can come back to school. However, you might think there's something funny going on. So if, teachers and head teachers deal with this all the time, where you think there's something not quite right, that somebody's making up that they've had a clinical assessment or something like that. In those kinds of situations, as you would with any illness, get a second view, have a word with the council, have a word with the parent, work out what's going on, and see if you can get to the bottom of it. In the end, as a head teacher, it's your responsibility to decide whether a child is well enough to be in school or not, of course, because that's you're in charge of the school, and use your judgment is what I would say. But don't discount the fact that if somebody's had a clinical assessment and they've said they're fine to be in school, that's probably okay. And you can always talk to your local authority public health team, who can assist with that kind of assessment as well, or give you some sage advice if needed. Should siblings be sent home as well when their brother or sister has a positive test? So yes, absolutely. If you test positive, then everybody in your household needs to self-isolate. So assuming the siblings live together, they should both be self-isolating. And hopefully they would have been isolating before they get the positive test, because they should be isolating, the whole household should be isolating as soon as anyone in that household gets symptoms. Where there is a delay, perhaps over a weekend, in the test result for a teacher or pupil which later comes back positive, how should we proceed? I'll answer that part of that question first. So it makes no difference is the basic answer. You'll remember from the webinar that what we look at for somebody who has symptoms is 2 days before they got symptoms until 10 days afterwards. And that period is the period when that case is infectious, and anybody who's been in contact with them during that period should self-isolate. Obviously, in a perfect world, people would have symptoms, then get a test straight away and get a result straight away, so all of this action can happen immediately. But we don't live in a perfect world, and we just have to live in the world we live in and deal with information as it comes to light. So it may be that the positive result doesn't come back until a few days later, and that means you're looking back quite a few days to 2 days before the onset of that child's symptoms. But that's fine. That's just what we do. Those time periods don't change. So it's 2 days before the onset of symptoms to 10 days after the onset of symptoms, no matter when that positive result comes back within that time period. The second part of this question is, does that mean that there's a risk of wider transmission in the school? Well, yes, it does, because that's why we're sending bubbles home. But the risk is quite small. So provided that child who is symptomatic has been sent home from school and isn't having continued contact with the rest of their bubble, the risk of onward transmission is pretty low. The thing we're trying to prevent by sending people home is that they avoid infecting other people before they become symptomatic. So there's a risk that that might happen within the bubble, which is why we try and exclude them. So if the longer they're in school, the longer they're in contact with one another. But as long as we take action as soon as we practically can, I think that that's the best we can do. And the actual increase in risk for a few days delay is probably very small. Where a child shows COVID-19 symptoms, but the parents refuse for them to get a test, what is the position for contact tracing? Okay, so the first thing to say here is if a child shows symptoms, then they need to be excluded from school for 10 days from the onset of those symptoms, and the rest of the household needs to be excluded for 14 days from the onset of those symptoms until they have a negative test. That is, until the case has a negative test. It doesn't matter if the rest of the household has negative tests. So the most important thing, the best thing to happen in this situation is for that child to get a test. And I think engaging with the parents, explaining that to them, maybe offering them one of the kits that schools have, might help reduce some of the barriers to them getting tests. But I appreciate that there will always be times when, because of problems with access to tests, or because a parent is refusing, or because of an issue with a specific child, they can't have a test. And we have to deal with these situations as they come up. What I would say is, if you have this situation where you've got somebody who's had symptoms and for whatever reason can't get a test or won't get a test, then chat it over with your local authority public health team, and they can come to us in Public Health England for a bit further risk assessment. The reason for that is our advice will change as the epidemic changes in the population. So we need to make a risk assessment essentially of how likely it is that that child is a confirmed case. If we think it's likely, then we'll just treat them as a confirmed case and exclude their contacts or their bubble as we normally would. If we think it's unlikely, then we'll just leave that one child excluded. But the way we make that assessment will change depending on how common the disease is in the community and the specific exposures that that child has. So if you end up in this situation, it's one to call your local authority public health team and chat it over, and we'll come to a risk assessment and work out what we're going to do. How do we manage asymptomatic cases which test positive? So again, the first and most important thing to say here really is that only people with symptoms should have tests. So with very few minor exceptions like healthcare workers, only people who have symptoms should get a test. You shouldn't be getting a test if you don't have symptoms. But As I've said, I realise we don't live in a perfect world, and there will be people who don't have symptoms who get a test. And what we need to do in those cases is treat them like we would any other positive case. The difference is they don't have symptoms, so you can't go back 2 days from their onset of symptoms. So what we do instead is we go back 2 days from their test date to 10 days after their test date. So that's 2 days before their test date to 10 days after their test date, and that's their infectious period. And otherwise, we treat it exactly the same as we would for any other confirmed case. And the last question, what should we do if a staff member has been incorrectly identified as a contact and told to isolate? So this is a bit of a trick question, and the trick is a bit hidden. So the problem here is, how do you know that that staff member has been incorrectly identified as a contact? Often we can make assumptions about who has identified somebody as a contact. But particularly as COVID becomes more common in the population, you may not actually know the person that said you are a contact. It may be somebody who you haven't guessed. So we need to look at these situations very carefully to make absolutely sure that the person who you think has wrongly identified you as a contact is really that person. So in these situations, what I would suggest you do is get in touch with your local authority public health team so that we can do a proper risk assessment, make sure that everything we think is going on is what's really going on, and then we can make an assessment and move forward. And of course, the local authority public health team can come to us in Public Health England for advice as required. We can override the advice given by NHS Test and Trace if it turns out that there is a clear error. So it's not a fait accompli. We're not going to say that if there's been a clear mistake made, then we need to stick with it, because that would be madness. But we do need to properly understand what's gone on in these situations and make sure we do a proper risk assessment to make sure that that staff member really hasn't been a contact of a confirmed case before we say that they can come back to work. So it's one to discuss as the situation arises. And that's the end of that section. So there are 3 other videos on other topics that questions have been sent in on, and there's the link to the webinar as well. But for now, thank you very much, and goodbye.